cat handling. Feral and free-roaming cats are special patients. These cats are not generally habituated to close human contact and arrive at the clinic in traps. Handling them appropriately and in ways to minimize their stress takes skill and practice. Make all efforts to plan ahead for these patients. If possible, have them arrive through a separate entrance or at a time period of little traffic. Processing feral or free-roaming cats through a general check-in will likely increase their stress exponentially. Instruct trappers to keep traps covered with sheets at all times. If a trapped cat arrives uncovered, have sheets available to cover the trap as soon as possible. Sheets can even be cut and sewn specifically to fit traps. This design allows easy access to the handle while staying in place on the trap. The cats in traps should be placed in an isolated, quiet room as quickly as possible. If they do have to wait in a lobby area for a few minutes, do not allow dogs to sniff around the traps. Do not allow these cats visual contact with any other animals in general. Dogs and other cats will be very frightening for them. Consider shelving in your lobby so if they wait, they may be elevated and hiding to increase any feelings of safety. The traps should be labeled for identification purposes of the cat. The traps are to be placed in a clean and quiet room. Consider adding some form of white noise, such as a fan, for additional environmental control. Again, ensure the traps are always covered with a clean, dry sheet. Trapped cats are visually inspected by an experienced staff member or doctor. Questions to answer during this inspection include: how does she look overall? What is an estimate of her weight? Does she appear to be thin and unthrifty, or does she look bright or dull? Is her hair coat thick and full, or is it sparse and matted? Does she have nasal or ocular discharge? If she does, is it clear or purulent or thick and colored? Is she sneezing, or does she exhibit any type of abnormal breathing? Is diarrhea present in the trap? Does she appear habituated to humans, as evidenced by her presence at the front of the cage, making eye contact and noise? Or does she appear very afraid and attempting to hide in the back of the cage? Is she very large, indicating she may be a male? Answers to these questions help staff members determine how each particular cat will be managed. Occasionally, these trapped cats will be declined for surgery by a doctor if they appear too sick to survive surgery or the recovery period. Very sick cats will appear emaciated with a poor hair coat and may have shallow or difficult breathing, severe diarrhea, be very dull, or have significant nasal and/or ocular discharge. Other cats may have symptoms of a mild upper respiratory infection, such as clear nasal or ocular discharge, or may have mild diarrhea but appear in decent health. Most often, circumstances dictate that these cats receive surgery, as it may be extremely difficult to retrap them. Many cats appear in good health and doing well. All feral or free-roaming cats will receive subcutaneous fluids while under anesthesia, and other single-dose treatments may be administered if necessary as funding allows. It is very important to have a strict policy of not attempting handling of a feral or free-roaming cat until she is under anesthesia. While it is true that some of these cats may be friendly, it should never be assumed that this means they are handleable. This is for both her safety and the handlers, as there will be very limited options for the cat in the case of a bite or significant scratch. All trapped cats will be induced by injection through the trap. For the induction by injection, the trap is taken off the shelf and placed on the floor. The sheet is pulled back for location of the cat within the trap. The trap will be tipped up on end if necessary. The more feral cats will often be frozen with fear and will easily be injected where they sit or lay. Cats less fearful of humans are often more difficult to inject. These cats require the use of the fork if they are moving around. The fork is slipped through the wire of the top of the trap and used to gently squeeze the cat against the end of the trap. The cat will be held in place long enough to receive her injection. The injections are always administered as accurately as possible into the large muscles of the hind end. After the injection, the trap is left on the floor and recovered with a sheet. The cat is looked at frequently as she succumbs to anesthesia. Over about an 8-minute period, she should become anesthetized and able to be safely removed from the trap. Watch her closely to ensure she does not block or kink her airway. When she stops moving her head, gently wiggle the trap. If she does not respond, open the trap door and carefully reach in. Place her in lateral recumbency if early in the 8-minute period or if not ready to remove her from the trap. If her sedation is adequate and a staff member is available to take her to the prep area, remove her from the trap and place her on a clean scale. Record her weight and place an identifying piece of tape on her head. Verify her gender. Wrap her in a clean blanket and take her to the prep area. At this point, please refer to feline anesthesia.